Hi, my name is Tori Johnson, and today I'm going to be performing the skill of therapeutic communication. I would make sure to follow all GPSP guidelines during this skill. I'm also going to assess my patient properly, get vitals if necessary. I'm also going to make sure that throughout this entire skill I'm following all therapeutic technique and not going away from that by asking open-ended questions, having good posture, and being there using therapeutic use of self, and not providing any advice to my patient, but just being there, whether that's silence or support. Okay, so I'm gonna get started. I would knock. Hi, my name is Tori. I'm gonna be a nurse today. Do you mind if I have a seat here beside you?
Yeah, go ahead.
Okay. How are you today?
I'm doing fine.
Just fine?
Yeah.
Okay. Can you tell me your name and date of birth?
Carmen Bruton, March 6, 2004.
Okay. Can you tell me a little bit about why you're here today, maybe?
I don't know. People have been saying that I have anxiety and depression, but I really don't think I have that.
Okay, so you don't feel that way?
No.
Okay. Is there any reason that you feel that you are here?
I don't know. I kind of get to where I don't want to leave the house some days. And I get really bad test anxiety. I don't, even though it's not anxiety, but.
Okay, so it's not anxiety.
No.
But you do have a deep sense of feelings with yourself.
Yes.
Okay, well, I definitely am here for you. Is there anything through the day or through your life that does make this easier for you? Do you have a good support system with friends, family, people from school maybe?
Yeah, I do. I mean, I would say so. I don't feel like they necessarily help me with anxiety. If anything, they probably add to it sometimes.
Okay. So it's obvious that my patient is having some denial and definitely is kind of deflecting her emotions towards her issues of why she's here. I would make sure that I offer silence if necessary, or offer myself in a supportive way for her, and ask questions that don't seem to further irritate or bother my patient while still providing care by having questions. Okay, so you do have a little bit of maybe a change in mood when you talk about school. Can you tell me a little bit about that?
Most days I cry before a test. It's just I get so stressed out. I don't really know what's going on, and then I'll study for days, and then afterwards I'll go home and I'll cry, and I don't want to leave my room, and this happens days afterwards.
Okay, so you kind of get stuck in this place for a long time when you feel it.
Yes.
Okay. Okay, well, I definitely am here for you. Is there anything that you feel like I could do to help kind of clear your mind about what you're feeling?
Well, do you think that there's any way that, like, what can I do? What would you think that I could do?
Well, we have tons of resources. I can set you up with, I know that you don't feel like you have an anxiety or depression, and it's all just what people say, but we can still do support groups. I can still talk to the provider about therapy, and we can also always talk to them about certain medications that might kind of help some of those feelings and that depression state off your shoulders. Does that sound like something you would be interested in?
Yes, I think so.
Okay, so I will definitely talk to your doctor, and I'll give you some resources so that we can find some group therapy and a support system for you. I know that you're in school and that's very stressful, but we are here to help you, and we're going to take that weight off as much as we can, okay? Okay, thank you, Carmen. I am going to talk to your doctor. I'll get those resources for you. Do you have any questions for me?
No, not right now.
Okay, thank you for your time today.